Anatomy, respiratory system, pleura. This is our final lesson on the anatomy of the respiratory system. The pleurae are serous membranes that line each lung separately. They're extremely important as they limit friction between the lungs. In fact, as with any other serous membrane in our body, we have a visceral pleura that lines the outer layer of the lung, and a parietal pleura that lines the so-called pleural cavities. The visceral layer and the parietal layer are joined by the hilum of the lung, thus creating a completely sealed area around the lung. That is indeed the pleural cavity. This space contains few milliliters of pleural fluid. The visceral pleura, which we see here on the bottom left, adheres closely to the lung and follows it in the pulmonary interlobar fissures. At the level of the hilum, it covers the part of the pulmonary plexus and then continues into the parietal pleura. It is difficult to separate the visceral pleura from the lung other than by dissection. The parietal pleura can be divided into three parts: a costal part, a mediastinal part, and a diaphragmatic part. The costal pleura extends from the posterior aspect of the sternum to the lateral aspect of the vertebral bodies. It is directly connected to the endothoracic fascia and follows the movements of the ribs during inhalation and exhalation. Furthermore, it can drag the visceral pleura into the thoracic expansion thanks to the thin veil between them. At the top, as we are going to see, it forms the pleural cupula, a structure that requires a special ligament complex to stay in place. The pleural cupula rises 2 to 3 centimeters above the first rib, topographically going into the neck. It adheres closely to the brachial plexus and the subclavian artery, the inferior cervical ganglion of the sympathetic system, the internal thoracic arteries, and the vertebral and intercostal supreme arteries. The mediastinal pleura is a thin membrane that adheres tightly to the mediastinal surface of the lung. It continues into the visceral pleura at the level of the pulmonary plexus and forms the pulmonary ligament, which is a triangle with the base at the top and the apex at the bottom. On the left, the mediastinal pleura is connected to the pericardium, thereby forming a section called the pericardial pleura, and to the aortic arch, the brachiocephalic vein, and the vagus nerve as well. In the posterior position of the mediastinal parietal pleura, the esophageal intra-aortic sinus and the esophageal interozygoous sinus are formed, which are recesses between the two organs just mentioned. The diaphragmatic pleura very accurately covers the upper side of the diaphragm, except for the area where it is connected to the pericardium, of course. It adheres very tightly to it on the lateral surfaces, moving far away from the pulmonary margin. A very interesting structure of the parietal pleura is the pleural suspensory ligament, which holds the pleural cupula elevated compared to the lung. The pulmonary apex touches anteriorly the right subclavian artery and superiorly the first intercostal nerve. We have therefore several ligaments that are responsible for holding the pleural cupula in place, like the vertebral pleural ligament, which runs from the body of the 6th and 7th cervical vertebrae to the medial part of the pleural cupula. The scalenus pleural ligament is a fibrous expansion of the anterior scalene muscle fascia, and it reaches the anterior part of the pleural cupula and the first rib. Lastly, the costal pleural ligament is stretched between the neck of the first rib and the lateral part of the cupula. In addition, the pleural cupula is supported by the branches of the adventitia from the esophagus as well as the fibrous tunic of the trachea. The pleural sinuses are recesses within the pleural cavity that contain several cubic centimeters of pleural fluid and represent the space that can be occupied by the lungs during inspiration. As the diaphragmatic pleura continues into the costal pleura, it creates a costal diaphragmatic recess, which can partially be seen here. Normally, this is a virtual cavity because during inspiration, the lung covers most of it. However, even at maximum inspiration, the lower margin of the lung never reaches the lower margin of the costal diaphragmatic recess. In fact, its projection is much lower than the margin of the lung, as seen above. Becoming the mediastinal pleura, the costal pleura creates a small sinus called costal mediastinal recess that holds the anterior margin of the lung. On the left, at the cardiac notch, the costal mediastinal recess runs straight, so the two costal mediastinal recesses are very close to each other, and their margin is just behind the sternum. The pleural sinuses are extremely important because in the event of a spillage within the pleural cavity, they are the first place where it settles. During inflammatory processes, it is in fact the pleural sinuses that one looks for the first signs of a spillage. As for the vessels and nerves, the pleural arteries derive from the internal thoracic, phrenic and mediastinal arteries. To supply blood to the various regions of the pleura, the pleural veins go towards the zygous vein circle. Lastly, the pulmonary plexuses are responsible for innervation. The structure of the pleura is quite simple. There is mesothelium that lies on a connective layer, which higher up is rich in collagen fibers and lower down is rich in elastic fibers. There is a final layer that is rich in vessels, after which comes the actual lung parenchyma. Here on the right, we can observe the visceral pleura that is attached to the lung parenchyma very tightly, and we can also see how thin and undetachable it is from the parenchyma.
This video was created thanks to Anatomy Learning, an interesting free web app. The hyperlink can be found in the description. Instead, the text used for the concepts is Human Anatomy of Eddie Hermes,